Hello everyone, I am Dr. Prasanth Reddy, consultant radiation oncologist. Today I am going to talk about cancer of uterus, or in medical terminology we call it as endometrial cancer. In females, cancer of uterus is one of the most common cancer, especially in elderly age group. However, we see this disease even in perimenopausal and younger females very rarely. So what exactly is cancer of uterus? This cancer arises from the epithelial lining, that means cells of the uterus, or sometimes muscle of the uterus, which is very rare. So what are the risk factors? Exact cause of endometrial cancer is not known. However, risk factors are especially in hormonal imbalance. Conditions which increases the level of estrogen is a risk factor. Conditions like obesity, type 2 diabetes, hormonal treatment, and in certain hereditary conditions like Lynch syndrome. So control of obesity is very important for prevention. So what are the symptoms? Usually these patients present with postmenopausal bleeding. So what is postmenopausal bleeding? The woman who has attained her menopause, she presents with the bleeding. Rarely in premenopausal and perimenopausal also they present with excessive bleeding or bleeding in between the periods. So how do we investigate? So once patient present with these symptoms, gynecologists they advise ultrasound or MRI if required. In ultrasound and MRI we see the thickness of endometrium. If cancer of endometrium is suspected, we do biopsy. That means taking a small piece from the endometrial tissue and we send it for histopathological examination. So once cancer of endometrium is confirmed, we do something called staging. For staging purpose, we do either CT scan or PET scan. So once this is diagnosed, how we proceed? The main treatment of cancer of uterus is surgery. Here, surgeon will remove uterus, ovaries and supporting structures. While performing surgery, surgeon will look for surrounding structures to just rule out metastasis. This surgery can be performed either open or laparoscopic or robotic. In stage 1, this patient doesn't require any further treatment. However, in stage 2 and stage 3, patients require radiation therapy and chemotherapy also. In stage 4, which is very unfortunate, where we cannot cure the disease, these patients will be offered chemotherapy, hormonal treatment, or immunotherapy also. So how do we prevent this? Before any individual starting hormonal treatment, especially for postmenopausal symptoms, they need to assess risks versus benefits before initiating hormonal treatment. Others can be, we can control obesity, that means maintaining healthy lifestyle, maintaining normal body mass index is very important, and type 2 diabetes needs to be controlled. Just for the sake, how can we diagnose at the early stage? Any postmenopausal woman who sees bleeding, it can be even spotting also, they need to come and see the doctor first, just to make sure that we can rule out cancer of uterus. Thank you very much.